Pandemic of coronavirus COVID-19.
Introductory Summary. The novel coronavirus is a viral disease that has been circulating among humans that causes symptoms of fever, cough, shortness of breath, pain or pressure in the chest, and blemished lips and face. Symptoms can ultimately lead to pneumonia, multi-organ failure, and even death if you do not seek immediate treatment. The virus was first detected in Wuhan City, China, in a live animal market. Now, the virus is highly contagious and travels as airborne droplets. On January 30th, 2020, the International Health Regulations Emergency Committee of the World Health Organization declared COVID-19 an outbreak. On March 13th, 2020, President Trump declared the outbreak a national emergency. At this time, there are no vaccines or definite cure for COVID-19. The CDC highly advises people to take extreme precautions to prevent the spread of COVID-19 while the pandemic is still under research. With the COVID-19 pandemic rapidly spreading, we need to do our part in actively preventing the spread of germs and ultimately the disease. Remember, older adults and people with underlying medical conditions, lung disease, heart disease, diabetes, etc., are at high risk of contracting the disease. If you feel sick or have any symptoms of mild illness or the common cold, see a healthcare provider immediately and avoid close contact with others. It is important for your provider to know your symptoms along with your environmental exposure. The most important prevention tips to keep in mind includes 1. Social isolation and limiting personal contact. 2. Avoid touching your face, eyes, mouth, nose. And 3. Upkeep with good hand washing hygiene. Updates. There are still no known cures or vaccines for the specific novel coronavirus. States are taking necessary measures and precautions to prevent the spread of the virus. Governor Doug Ducey announced that Arizona schools will be closed from March 16, 2020 through March 27, 2020 to lessen the impact on Arizona families. The state of Washington has recently began medical trials in hopes to find a vaccine for COVID-19. As we continue to take necessary precautions as recommended by the CDC, it is important to be informed and updated about factual information. This presentation consists of important prevention information regarding COVID-19 from the U.S. Army Public Health Center. Face masks. The primary purpose of a face mask is to prevent individuals who are sick from spreading germs onto others. For those who are healthy, you only need to wear a face mask when taking care of someone who has COVID-19, as there is no evidence that wearing a face mask prevents infection. Remember, N95 respirators are not face masks, nor do they provide any extra protection against environmental factors. When should I wear a face mask? When you are caring for someone with COVID-19 or when a medical provider diagnoses you with COVID-19. The proper use and wear and disposal of face masks. Number 1, perform hand hygiene with soap, water, and or alcohol-based hand sanitizer before putting on the face mask. Number 2, ensure that your face mask covers your chin, mouth, and nose. Press the nose piece tightly against your nose bridge, allowing a snug fit. Number 3, avoid touching the face mask and replace it with a new one if it becomes torn or wet. Number 4, in order to remove the face mask, grasp the elastic band or untie the mask and dispose it in a lined trash container. Never touch the front of the face mask. Number 5, clean your hands immediately after removing the face mask. Self-monitoring and quarantine. If you have been directed to quarantine or self-monitor at home due to possible COVID-19 contact, please take the following measures to prevent the spread of the disease. Number 1, stay home from any public places. If you need to leave your home for any reason, avoid public transportation and public contact. Number 2,
Monitor your symptoms by checking your temperature daily. Report any change of symptoms to your healthcare provider. Number 3, get rest, stay hydrated, and exercise. These 3 tips will help with recovering from the symptoms. Remember to avoid public places like gyms when getting some exercise in. Number 4, contact your healthcare provider or 911 if you feel like you may have been exposed to COVID-19. Number 5, isolate yourself from others and avoid sharing personal items to prevent the spread of disease within your household. Number 6, disinfect and clean all touched objects and surfaces. Please remember to follow the directions on the cleaning label for adequate results. Number 7, continuously perform hand hygiene and do anything to actively prevent the spread of germs. Protecting yourself and your family. Take these everyday actions in order to prevent the spread of germs. Number 1, avoid close contact with people who are sick. COVID-19 is a virus that can easily be contracted through airborne droplets. As a community outbreak, it is highly recommended that we start practicing social distancing, including stop giving handshakes and hugs to protect yourself and others from possible contamination. Number 2, wash your hands and practice good hand hygiene. As we use our hands to perform the majority of daily tasks, it comes into contact with a lot of dirt and bacteria, even when they are not visibly soiled. It is important to wash your hands for no less than 20 seconds with a lot of lather and friction. Constantly performing hand hygiene can reduce the risk of coming into contact with the virus. Number 3, avoid touching your face, eyes, nose, and mouth. Your hands come into contact with bacteria whenever you touch any infected surfaces. When you touch your face without proper hand washing, you are more than likely to spread the bacteria and become ill. Number 4, cover your coughs and sneezes with a tissue. COVID-19 is highly contagious when someone who has the illness coughs or sneezes without covering their mouth, nose, and perform hand hygiene. Covering your sneezes and cough with a tissue and disposing the tissue will prevent the further spread of the disease. If tissue is not available, cover your coughs and sneezes inside your elbow. Number 5, stay home when sick. It is exceptionally important to stay home and self-isolate yourself if you feel sick for having symptoms of illness. COVID-19 symptoms may not appear until the 14th day after being contacted, so it is vital to upkeep and maintain your health at all times. Number 6, continue everyday actions to prevent the spread of germs. Routinely clean and disinfect areas and items that are always in contact with you and other people. Use alcohol-based hand sanitizer after hand hygiene or when needed. Additional precautionary steps to take to protect yourself and your family. Number 1, ensure all immunizations are up to date, including the seasonal flu shot. Number 2, restrict traveling to areas of active disease transmission. Number 3, comply with medical orders. Number 4, ensure you have enough food, fluids, and medication for 14 days. Number 5, seek guidance from the CDC, employers, leaders and officials, and local public health agencies regarding updated information, policies, and procedures regarding the pandemic. Number 6, prepare for travel restrictions and cancellations of any gathering events. Number 7, create an emergency preparedness kit. Frequently asked questions. How severe is the COVID-19 illness? Reported illnesses range from very mild, with no symptoms, to severe, including some deaths. Adults 65 years and older and anyone with underlying health issues are at risk of developing severe illness from COVID-19. What should I do if I have been exposed or have symptoms of COVID-19? It's important to first speak to your physician or a registered nurse. That individual would assess your symptoms and advise you what to do. Should everyone get tested for COVID-19? No, you should only get tested if you show symptoms of COVID-19 or if you've been in an area where COVID-19 exposures are high. Your healthcare provider will then make a decision to get tested based on your symptoms and exposure. I heard someone tested positive for COVID-19 at my clinic or hospital. Should I be concerned? No, clinics and hospitals follow federal and state regulations and guidelines in keeping sick patients away from others, along with following guidelines of infection control. What is the treatment if I'm diagnosed with COVID-19? Most people can recover from COVID at home. Treatment is similar for that of the flu, rest and fluids. There is no recommended or licensed antiviral drug at the time for COVID-19. Frequently asked questions regarding children. There is no data that children are more likely to get ill from COVID-19. Infection prevention with children are same with adults. Hand washing hygiene, cover sneezes and coughs with tissue or inner elbow, stay away from sick people, and staying up to date with flu vaccinations. Treatment for children is also similar with adult treatment, rest and fluids. Frequently asked questions regarding pregnant women. Pregnant women experience many changes throughout their pregnancy, which may make them more likely to get respiratory infections or COVID-19. Women should also take the CDC recommendations on infection prevention like all adults. There are no studies or research regarding if COVID-19 can be transferred to a fetus or through breastfeeding, nor do we know if the virus can affect pregnancy loss or birth defects. Tips to stay well. I whack germs. Immunizations are important to protect you from diseases. W. Wash your hands often with soap and water for at least 20 seconds. H. Home is where you stay when you are sick. A. Avoid touching your eyes, nose, and mouth, especially when you are sick. C. Cover your coughs and sneezes so you do not spread germs to others. K. Keep your distance from sick people so you do not get sick too. G. Good. E. Environmental. R. Response. M. Monitoring. S. System. Good environmental response monitoring system. We are praying for divine protection for each and every one who are on the front lines fighting off this virus. May the good Lord protect us all and keep us away from harm and danger.